Hi everyone, this is Elena Bejarano. I'm the Director of Health Services here in EPISD. We're very concerned about your health and safety. We're going to do a brief video instruction on PPE, which is personal protective equipment. Now, most of what I'll use today is geared towards our special education teachers, faculty, staff, for our special ed students, because they're going to need more protection during their medical procedures and some basic care for them. So just kind of keep that in mind. The CDC's recommendations are that everyone wear a face covering. So we're going to enforce that, but there's lots of different kinds. I have a reusable, washable mask that I'm using. It's super comfortable, easy to hand wash, hang up to dry. You can wear this every day. I would wash it several times a week. I'm going to show you a face shield. This one has a plastic component to it that covers your eyes and your nose and mouth. This would be used during any kind of special ed procedures, suctioning a student, feeding a student. If you can get different sizes in these as well, and then this will help protect your eyes if any splash or splatter occurs. This one is just a regular surgical mask. It does have a metal nose piece in it, and these are also really good protection. You can wear these a day or two, keep them in a Ziploc bag, and then go ahead and toss them and get a new one after a day or two. This one I'm fortunate enough to have, it's an N95. These we're using for our medical staff. So these are not required, and CDC is not requiring them, and they're super hard to find. So any of these masks that I'm going to show you will work just as well. This one is more of a dust mask, but it does have some filtering capability. The most important thing about your mask is you cannot wear it below your nose or under your chin or have a loop hanging. It has to be tight, unfortunately, somewhat uncomfortable. But if it has a nose piece, it has to be pinched around the nose. If you find that your glasses are fogging up, probably due to that nose not being pinched correctly. So kind of keep that in mind with your mask. Most of these you can put in a Ziploc bag and wear for a couple days, okay? But they are meant to be disposable after that. That covers kind of the mask component. Like I said, a washable one, you're welcome to wash it and reuse it. These, a day or two, 3 at the max, and then you'll have to get rid of those. This is a hair covering, not really the most fashionable, and it doesn't have to be worn, but if you really feel like you're going to encounter spray or splatter, there are a couple of these in health services that we can get for you. Booty covers are the same way. Nursing, we have a little bit more body fluid to worry about, but I just wanted to show you the booty covers go over your shoes, and that's some extra protection if you need it. The gown I'm wearing is an isolation gown, mostly for medical personnel, but they're also disposable for any special ed teachers or paras that may encounter body fluids with their students. So this is what I'm wearing today, and they look like this in the package. They're not necessary if you're in a gen ed classroom or just dealing with students that don't have medical procedures. The gloves I'm wearing, these are nitrile gloves. They're latex free. Very important with our special ed students. Order everything latex free. They have a lot of latex allergies. They're very comfortable. You'll just have to find your size. What I can say about the disposable gloves is they're meant to be disposable. You're not meant to wear them for 8 hours a day. You're meant to do a procedure, take them off, and wash hands. Super important. We have a hand washing training on the university that you can always go to and look at. I encourage that. But please don't wear the gloves multiple times when doing procedures, and always wash your hands in between. Hand sanitizer is absolutely fine when you can't get to soap and water. Most important during this time for your safety and others is to keep those hands washed. Warm water, soap, at least 30 seconds, if not a minute or two, really scrubbing your hands. So this is what these look like. Sometimes you'll see them black, sometimes tan. Just make sure that they are medical quality and not food grade for your gloves. We're going to show you a little bit about how to put on PPE. Gloves are very, straightforward. But when you're taking off gloves, you don't want to infect the rest of your body by what your hands have touched. So you're going to get underneath the glove, you're going to pull straight off, and you're going to grab it with your other hand. You're going to grab again underneath, pulling off like this, and then you're going to toss those away. You're going to scrub up your hands really good, put on new gloves if you need to. It's only encouraged for gloves when you're doing a procedure that necessitates that. So make sure that you're only wearing gloves when needed. It's not recommended by CDC that you wear them all the time or all day. So just kind of remember that. This is a no-touch thermometer. All the nurses will have that. They're going to show how to just point and click. Now you have to be a couple inches away. They're in no contact, but you still have to be pretty close. So that's how we're going to use that. Every nurse will have a brand new thermometer. We might have some of these in our special ed classrooms so they can take teachers' temperatures as well. And that's just one of those items that will help keep everybody safe during this time. That kind of wraps up our PPE. Make sure you're throwing the PPE in the trash can. We're going to advise our custodians to wrap up those bags, throw them away safely. And I appreciate your attention and keeping our students safe and healthy.
How to safely put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room.